Hi, this is almost everything you'll need to know about the carpal bones and also the hand bones. The carpal bones are these 8 bones of the wrist. Carpus means wrist, and these are short bones. They're more or less quadrilateral in shape, and they're arranged in 2 rows. There's a proximal row of carpal bones, these 4 bones, and a distal row of carpal bones, again 4 bones. So 8 bones in total. There are plenty of mnemonics and memory tricks to help people remember the names of the carpal bones, but it's probably best just to understand why they have the names they have, and that way you'll be able to identify them more reliably and accurately. Having said that, the first bone that we'll deal with is this one, the scaphoid bone. Scaphoid means boat-shaped, and it's perhaps a little difficult to see a boat here. If we isolate the scaphoid bone, however, we may be able to appreciate that it somewhat resembles a boat. We could see maybe the bow end here, the hull and keel here. This is the stern end. This is the sort of cabin or working area, deck, and we could perhaps imagine a sailor stationed here manning his craft. The scaphoid has some bony features of its own. It has a tubercle here that projects laterally and anteriorly. It's palpable in the anatomical snuff box, and it helps to carry the bone at the base of the thumb in the distal row. The scaphoid also features a waist, a narrowing here, separating its proximal pole from a distal pole, and the waist is the area through which the scaphoid is most prone to fracture. The scaphoid tends to be the bone in the wrist that is fractured most frequently because of its position in the wrist rather than any intrinsic weakness. In this view of the scaphoid, we can see, this is the left scaphoid this time, we can see the tubercle here, which would help carry the bone at the base of the thumb, and we see the waist here perhaps more convincingly. Some people think that in this particular view, the scaphoid looks less like a boat and more like that time they saw Marilyn Monroe on the beach. But that probably says more about them than anything else. The next bone is the lunate bone, which is this bone here. This and the scaphoid bone are the only 2 bones that have articular surfaces for the radius. The lunate has its name because from the lateral projection it has a crescent shape. That's not so obvious here, but again, if we isolate the bone, we can see here quite obviously the crescent shape, particularly of this articular surface. The last 2 bones in the proximal row sit one atop another, and the one that is most anterior or on top is the spherical small pisiform bone. Pisiform means P-shaped, so no further explanation probably required there. The bone it sits on, the more posterior of the 2, is the triquetral bone, or sometimes just triquetrum. Triquetral means 3-sided, more or less wedge-shaped, and the triquetral bone is wedged in here between its neighbors. It's important to note again that the triquetral bone has no proximal articular surface for the ulna or radius, so only the scaphoid and lunate bones have articular surfaces for the radius at the radiocarpal joint. Again, the head of the ulna, this articular surface here, does not participate in the wrist joint. It is prevented from doing so by an interposed fibrocartilaginous disc that separates the head of the ulna, the articular surface, from the carpal bones. The first bone in the distal row is this most ulnar bone, and it features a quite sharp anterior projection, which is the little hook. In Greek, the word for little hook is hamulus, and so this bone is the hamate bone. It's the bone with the little hook. The bone next to it is the largest bone and the most central bone in the carpus, and it is the capitate bone. Capitate means head, but we can interpret it to mean the largest bone, so large capital, like capital letter. So the capitate bone. The bone next to it, which articulates with the index finger metacarpal, is the trapezoid bone. It's trapezoidal in shape. Here it's being obscured somewhat by its larger neighbor, the trapezium. So the trapezoid and the trapezium are commonly confused. The best way to remember which is that the trapezium articulates with the thumb metacarpal. So it's the bone at the base of the thumb, and the trapezoid is the other one. The trapezium also features this very prominent anterior projection, which is the tubercle of the trapezium, and it's closely aligned with the tubercle of the scaphoid that is proximal to it. The tubercle of the trapezium and the tubercle of the scaphoid project anteriorly on the thumb or radial side of the wrist, and the pisiform bone and the hook of the hamate project anteriorly on the little finger or medial or ulnar side of the wrist, and they form walls of the carpal tunnel. We can see the carpal tunnel more clearly from this perspective, with the tubercle of the trapezium and the tubercle of the scaphoid projecting anteriorly on the thumb side, and the hook of the hamate and the pisiform bone projecting anteriorly on the ulnar side or little finger side. The other carpal bones here forming the base, and a strong ligament stretching between the anterior projections, which is the transverse carpal ligament, and through the carpal tunnel run the tendons of the long flexors of the digits, 2 for each finger and 1 for the thumb, and also famously the median nerve runs through the carpal tunnel. So the carpal tunnel provides protection for these structures as they cross the wrist. The wrist is a particular area for trauma, such as when falling on the outstretched hand, or sometimes even using the hands for hard labor, or when performing, for example, a particularly aggressive face palm. However, the downside of this is that the structures within the carpal tunnel, and particularly the median nerve, can become compressed, resulting in paresthesiae, numbness, and sometimes even weakness of the structures that the median nerve supplies distal to the carpal tunnel. Looking at this posterior view, we can review the names of the carpal bones briefly. We have the scaphoid here and the lunate articulating with the radius, the three-sided triquetral bone completing the proximal row. We can't see the pisiform because it's projecting anteriorly. The hamate here, again, we can't see the hook. The capitate, the largest bone in the carpus. The trapezoid here articulating with the index finger metacarpal, and the trapezium articulating with the metacarpal of the thumb. The intercarpal joints are relatively immobile. The carpal bones are almost locked together in this irregular jigsaw puzzle. The middle carpo-metacarpal joints are also generally held closely together and fairly immobile. The fifth carpo-metacarpal joint, the one for the little finger, is allowed a little more freedom of movement, but the first carpo-metacarpal joint, or the carpo-metacarpal joint of the thumb, has saddle-shaped articular surfaces and is capable of a wide range of movement, including flexion and extension, abduction and adduction, and together these can combine to form the movement of circumduction, so that the distal part of the thumb metacarpal can move in a circular motion. There are 5 metacarpals, and they are all long bones. They have a shaft, and at the proximal end a base, and at the distal end a neck and a head. The bones distal to the metacarpals are the phalanges. There are 2 phalanges in the thumb, a proximal here and a distal phalanx. The fingers all have 3 phalanges, so they have a proximal, intermediate, and a distal phalanx. The metacarpophalangeal joints are all condyloid joints, so they're capable of both flexion, extension, and also abduction and adduction, which again means that the distal parts of the proximal phalanges can move around in a circle, so they're capable of circumduction. The joints distal to the metacarpophalangeal joints are all simple hinge joints, allowing flexion and extension only. There are proximal interphalangeal joints of the fingers and distal interphalangeal joints, whereas the thumb has only one interphalangeal joint. We'll return now to just the carpus and look at it in this nice section and remind ourselves of the names of the bones. We see the radius here, and we can actually see the articular ridge that separates the sockets, if you like, for the 2 carpal bones that it articulates with, and they are most laterally the scaphoid and here the lunate. And we can see here the triangular fibrocartilage that separates the head of the ulna from the carpal bones. And the triangular fibrocartilage, or TFC, is attached to the styloid process of the ulna. We can also see here how it separates out the distal radio-ulnar joint from the radiocarpal joint. This is the wedge-shaped triquetral bone. Distal to it, the hamate bone, and here the large capitate bone. This is the trapezoid, and we're just seeing a little of the trapezium because most of it's out of the plane of this section here, but that would be this bone here. Again, the pisiform is out of the plane of section. We'll do some more practice with an X-ray. We can see the radius here, the ulna. This is the scaphoid. This is a younger person. I can see they still have unfused physes. So the scaphoid does not have its characteristic mature shape, but we can identify it because of its position. This is the lunate, and here the somewhat wedge-shaped triquetral with the pisiform over the top, projecting anteriorly. This is the hook of the hamate. That's the appearance on an X-ray of the hook of the hamate. And this is the hamate bone, the very large capitate bone, and the trapezoid here being partially overlaid by the trapezium. Trapezium. The more critical view of the wrist in terms of identifying unusual injuries is the lateral view. In high energy injuries, such as falling from a height onto the outstretched hand or falling from a moving vehicle such as a motorbike or motor scooter, several dislocations of the wrist can occur, and they can be best identified from this lateral view. In the normal view shown here, we can see the lunate bone and the pisiform bone projecting forward. This other bone projecting forward is the scaphoid, and on top of it is the trapezium. This is the hook of the hamate, and we can see that the crescent of the lunate cradles, if you like, or appears to cradle anyway, the base of the capitate bone here. Sometimes in these high energy injuries, the lunate bone can dislocate anteriorly, and that is known as a dislocation of the lunate. Another type of injury is where the lunate and usually the scaphoid remain in place articulated with the radius, but the rest of the carpal bones dislocate posteriorly, and that is a perilunate dislocation. That's just about everything you need to know about the carpal bones and the hand bones. You should consult your textbooks for detailed information, but apart from that dreary task, enjoy the rest of your day.